Hello, this is Dr. Kevin Connors, Section 7 of Beating Chronic Lyme. This section we're going to be talking about how do you test for it. Now, the video here is going to be short because there's a lot in the written material of this part. Um, Understand that there's a two-tier testing system for Lyme that the Centers of Disease Control, that's a little emblem down at the bottom right, recommends. It's a enzyme immunoassay, and then depending on if those are positive or negative, you move forward from there. Now, I'm just giving total lip service to this. Even in the book, I'm giving lip service because that's not how I test for Lyme. So I use a special type of kinesiology for testing that's very, very accurate. If you don't have that access or somebody with that skill level to test for that, then you have some choices. So now you'll see what I recommend in the book. So that's not even my recommendation, even if you have Lyme disease. So if you have acute Lyme, again, I'll go back to what I said in a previous presentation. So if you live in a high Lyme area, you have all the symptoms of Lyme, and it's at a time of Lyme, so it's not in the middle of the winter, okay? So then it's probably the flu. But if you have flu-like symptoms and it's in the summer and you were out working in the yard, whether or not you even have a rash, you should probably treat it like Lyme. So again, you have to find a doctor. So if you live in a Lyme area, it's a good idea. You don't have Lyme, it's a good idea to find a doctor right now that will treat you based upon your symptom pattern, based upon using wisdom and not having to depend on a test, because the longer you have to wait, even if that test was perfect, even if we had a perfect test, which, understand, we do not. Some reports say that up to 70% of initial Lyme assays give a false negative. So realistically, maybe it's 30%. I don't care if it's 10%. To leave 10% of the people thinking that they don't have Lyme disease, so they're not treated with an antibiotic, which could have killed it in that window, having to suffer for 10 years with chronic Lyme and just ruin their life, is malpractice in my book. Downright malpractice, because you can't use your stinking head and years of wisdom based upon you actually trying to get patients better, to get people better, and use an antibiotic that will knock it out of them. There's lots of ways to heal the gut barrier if you damage it with the antibiotic. Besides the fact that you're probably damaging your gut barrier by eating genetically modified foods and foods with all sorts of chemicals in them, besides using an antibiotic for 10 days, killing a Lyme disease. That could put you in a state could kill you if you don't treat it correctly. So you're in a Lyme area, just treat it that way. The one test that I do recommend if you're going to get a lab test is the IGeneX labs. I believe they're out of California. There's their symbol on this picture. I have more information in the section of book that you just downloaded. So treat it like Lyme. If it's in the chronic stage and you don't know it's Lyme, you can get the test. Unfortunately, the tests are immunoglobulin tests, and they're not always positive. After it's in its chronic stage. So many times the immunoglobulins decrease after about 6 weeks, and you can even have a greater chance of showing a false negative. All right, read this section, and if you have any questions, contact our office.